Welcome to Advanced Nurses. We connect with nurses who inspire other nurses by sharing their experiences. And so we're able to bring that information to you. Hi, I'm the educational consultant with Advanced Nurses at ACD for N. And today I wanted to actually talk about why it shouldn't be the end of the world if you are in nursing school and you fail one of your courses or you fail a semester and you have to drop out, or if you choose to move forward without completing the nursing program and you explore other options within healthcare or maybe in other industries. So, I really want to give you reassurance that it should not be the end of the world. Why? Because there's a lot of things that you have to deal with when you go into the nursing profession that is not necessarily always obvious when you're in nursing school. So, I'll start off with my number one thing is the misconceptions people have about nurses. So, nurses do make good money, but nurses are not paid their actual worth. So, for example, um, the payment structure oftentimes for providers is that it's the services that the providers are providing the patients that's kind of like driving the revenue. However, nursing staff is really considered more of an expense to these institutions. They, specific, just particularly hospitals, they are expense. So therefore, oftentimes the goal is to have the least amount of nurses to take care of these patients. So that I think is the beginning of the problem. And because most of what we understand as nursing, as far as even in a lot of nursing programs, even to today, as dynamic as nursing is, and as all the different industries and places where nurses can work and are currently working, um, nursing programs for the most part focus on nurses working in the hospital setting. And so, in that hospital setting, there is, and there has always been, this understanding that nurses are just there to kind of like fill in the gap. So, there are some nurses, there's some hospitals, like there's one here in Philadelphia that closed named Hahnemann. I remember them actually letting go their CNAs, okay, their certified nursing assistants, so that they can have the nurses, really be those individuals working within the hospital, caring for all aspects of that patient's care. Of course, you can imagine that was, you know, very much, a problem for any kind of registered nurse working in that facility or working on any of those units that didn't have CNAs there, because of the fact that it's like now every single thing you have to do for that patient. And so, again, this is the reason why we have to show respect to every single person that provides direct patient care. So that is from the CNA to if there's LPNs working in that facility. There should not be this idea that the doctor is the most important person, because as you could see, and I'm sure you've experienced it if you were ever hospitalized or you visited a family member who's hospitalized, or maybe if you've even heard stories of people who are hospitalized, one of the most common complaints is that they were expecting to see the doctor more. Well, a lot of that happens because in movies, I think that the medical profession, I'll give them credit for this. They have been very good at protecting their image, and so there's always this idea. To have this doctor at the bedside, if a patient is coding, like, that patient looks like they're about to die, you have these doctors running the room, the movies, like, the movies cover it, shows like ER, sensationalize all these things that doctors do. And I'm not saying that doctors and even nurse practitioners or PAs, they don't have very important roles and they're not, holding a lot of responsibility about the outcome, regarding the outcome of patients' care. But the truth is that a lot of what we have observed and a lot of what we continue to observe as being this kind of fly in, responsiveness and this protective, nature of one's care when they're in the hospital, and really in all settings, but particularly in the hospital setting, that's really the nurse. So, what people will say sometimes is, oh, it was only a nurse coming in here or whatever. Well, the truth is, when you go into a hospital or you go to a nursing home, right, you are going there to get care from a nurse. Because if you were trying to go there to get care from a doctor, then you would go to your doctor's office, right? That's the way your doctor is. They're at an outpatient office. But when you go into the hospital, that's for who's really going to be taking care of you. It's going to be the nurse. And oftentimes, because nursing does get direction from medicine, not exclusively, but for the most part, most of the nurse's role is directed by the provider's direct, orders and recommendation. Oftentimes there is, even amongst nurses, there's this idea to say, well, I'm just a nurse, or just to look at things from a perspective of, well, I'm just following what the doctor said. And most nurses know that that is not particularly true, because I'll tell you one thing: in nursing, many nurses will know this, maybe some nursing students as well, maybe all nurses know this, but if a nurse administers medication to a patient and the patient has an adverse outcome, such as they need, intense services and treatments because something happened. Let's say someone had an anaphylaxis response to a medication that they're allergic to. Or maybe if it was a known allergy, that's even worse. If it was a known allergy and was it prescribed on accident, if that nurse administers that medication because it was a known allergy for that patient, the nurse is held responsible. If there's a medication that has a risk for an adverse response, and the nurse is there to monitor if that adverse response does occur, and if it does, and that nurse has not documented it, treated that adverse response, and did not have a plan of action in place to deploy, the nurse is held responsible. Incorrect medications being ordered for a patient. Um, Providers do it all the time, right? We shouldn't have that stuff happening all the time, but it happens because providers are human beings, right? And so when that nurse administers that incorrect medication, the nurse is the one held responsible. So please explain to me how this is a person who we should be putting in a box of, oh, they're just pretty, oh, they're just cute, or the idea of your night nurse, right? So that's supposed to be like, this little sex kit nurse. And so what happens oftentimes is the actual and true role and responsibility, accountability that nurses take every single day when they are caring for patients is not fully understood, I think, by society as a whole. And I think it definitely affects the way nurses, even nurses who've been in the profession like myself for over 10 years, or even new nurses, when they're new to the profession and they're like getting this eye opening, like, whoa, in nursing school, there was so much emphasis on the science and chemistry and everything that you need to know to prepare for your boards and to get through your program, pharmacy, all these courses that you have to take. A lot of programs now have incorporated even the informatics in there. So we have all of this that the nurse has to wrap his or her mind around. And which, again, let me just, on a side note, this is what makes nurses uniquely different than providers. And I say that to say a nurse practitioner is going to come to the table with something uniquely different than a medical doctor, because a medical doctor is focused on prescribing and diagnosing, where that nurse practitioner would have come from a perspective, even if they have not spent a day on the floor, which I don't recommend. But if that nurse practitioner has not even spent a day on the floor and they went through one of those accelerated programs where you can go straight into an MP program, after completing, of course, your required coursework, those nurse practitioners are going to have a different perspective because of the fact that there is, within that nursing education and training, that accountability and responsibility to be responsive to that patient through every part of that healing process. Think about it. A doctor is not expected to be with that patient throughout the entire healing process, but a nurse is, right? So you can imagine a nurse practitioner's perspective is going to be uniquely different than even a medical doctor. So the misconception that a nurse practitioner or a nurse is choosing nursing or to be a nurse practitioner just because they couldn't afford, they didn't have the brains or the determination to be a doctor is foolishness. I'll also say something else too. If you were interested in working in other aspects of healthcare, such as, again, like informatics, if you wanted to go into HIM, I'm not saying that, and when I say HIM, health information management, I'm not saying that you could not do so as a medical doctor or become, go into HIT, health information technology. I'm not saying that a medical doctor could not do so, but just really think about it. The medical doctor is focused on prescribing and diagnosing. The nurse is properly put, that the nurse's position is properly placed where that nurse could actually have a huge impact in system design and developing solutions for healthcare systems and identifying problems in the healthcare system, anything from the actual layout of the unit to ratios to you know uh, looking at inventory. There's so many things that I think that a lot of healthcare institutions have given away to people with a finance background or IT background or engineers or project managers, and they've taken that away from the nurse. And I think that takes away from how nurses really should and can see themselves in the workplace as having an impact to the overall healthcare system. So I think that those are some of the misconceptions. And so I go back to, if you are in nursing school and you are not having the best experience, right? So like, let's say you're in nursing school and you're thinking to yourself, oh my gosh, I don't know if I can continue in this program. It doesn't seem like it really fits me. It is okay to walk away from that nursing program, because a lot of these misconceptions will probably be with nursing for a very long time. And you may be surprised that with all the fighting and all the sleepless nights and all the stress and all the crying that you go through when you're in nursing school, because I also want to emphasize, if you talk to anyone go through medical school, they'll tell you medical school is really, really tough, right? But ask anyone who goes through nursing school, they will tell you that it's really tough. Now, I'm not going to go through the struggle Olympics about who's struggling the most and who has the more intense program, because the truth of the matter is, when that nurse is asked to go on the floor and actually work with those providers and patients and family members, it won't matter how difficult the school program was or the schooling was, because the responsibility is still going to be the same. You will still be the person responsible for the outcome of that patient once you administer that medication. You'll still be responsible for understanding all of the possible outcomes of that medication that once it's administered. The pharmacist may tell you some things that could happen because they are keeping record, of the different responses patients have to medication. Of course, labels are on medication, so there's adverse responses, some expected and some unexpected, that you will be a part of your patient education when you administer medication. But that doesn't take away from the fact that whatever you monitor and observe as a nurse it's your responsibility to document that. That is the reason why nurses are constantly in these court cases. And you tell me that this is a profession where hard sciences and being analytical and being forward thinking and planning and even thinking about the nursing process, right? That whole entire process, okay, and what the nursing process really means. You tell me that these are individuals that are not very much engulfed in what you would call the hard sciences, which is typically something in some nursing programs. Some universities do consider nursing a part of STEM, but there's this whole argument also, is nursing a part of STEM? And why? It's because of this misconception that all nurses are doing is getting dressed up and being little glamour pusses and just getting around with, maybe even sleeping around with the doctors, or just coming to the nurses station and hanging out with matching cups. They have their little Stanley cups with their matching scrubs. And, these are all misconceptions that, again, if you are coming into nursing with the idea that that's what you're going to do, I think it's best that you drop out of nursing school right now. When you go into these floors, when you go into these homes, when you're doing community nursing, whatever nursing you do, when you're working for an insurance company, you are going to be expected to know, okay? So many different things at once, and know when to deploy the information that you know and the system thinking that you know. And if you don't know it, they're going to make you know it, and it's going to be the difference between you working and not working. So if you think that you're coming into a profession that, just like everybody else is saying, oh well, oh, nurses, they're not, you don't have to take a nurse serious. If you're thinking that you're coming to a profession hoping that it's a profession where you don't have to be taken serious, this is not the right profession. The problem with nursing right now, my personal opinion, is that it needs to be completely rebranded. Nurses take on a huge amount of accountability, responsibility, and are expected to know so many things about science, about the body system, about the healthcare system, and then also have to show all of these soft skills, right? Be approachable, use therapeutic communication, be responsive to your patients, responsive to their family members. So you're almost asked to be an almost like function almost on expert level in some areas, and so that you're held to such a high standard that it's not reflected in what you typically see in films, where you may see a film where you don't even see a nurse coming into the room at all. You may see shows like and Scrubs, for example, where you may see nurses kind of like goofing around, and you're not seeing nurses being taken serious, you know. And so, therefore, if that is your perception of nursing, this would be a good time for you to leave the profession while you're in nursing school. If maybe some of the reason why you can't pass through the program is because you thought that it was an easy program. That happens a lot of times. And it happens a lot of times. Sometimes when you hear people saying that they were in nursing school and they're like, oh, it was so hard. I barely got out of nursing school. A lot of it is because that person went into the nursing program thinking it was an easy program, and what they were confronted with was a program essentially bringing you in with candy, right? Imagine Scrubs, seeing people on the unit say, don't you want to be just like one of those? They have a condensed program. Most nursing programs, if you have the BSN program, about 4 or 5 years, right? They have the 2-year associates program, and there's some diploma programs, but I think all of the programs for the most part are about 2 years. You may be able to get an 18-month accelerated BSN program. And of course, you have graduate entry as well. You can go into a master's program directly as well. But it doesn't matter how you cut it. If you are approaching it from a perspective of, well, it's such a short program, how bad could it be? It is as bad as you think it is. It just as what I'm saying to you right now, as a nurse I've been a nurse for almost 13 years. It is just as bad as you think it is. So you come in with a perception that it's going to be, fancy clothes, Louis bags, a designer car, and you're going to live this high life. And some nurses who show it, I'm not mad at them for that. If that's the part of nursing that you are proud of, what you're able to spend your money on, that's great. But I'll say this: it does send the wrong message to a lot of these nurses who, when they come in, just like, and I'll say this: it's no different than if a person is working at one of these mega companies, such as, Meta or Google or Microsoft, or, it's one of those mega IT companies. And, the person is showing you their flashy car, but they're not telling you about all the sleepless nights where they had to learn, high level, calculus and, physics. They're not showing you that part, right? They're not showing you maybe some ways to do really good in math to get to where they're at, but they're just showing you the high life, like where, what they have been able to acquire because of working at these places. So, to me, that's what I think the problem is oftentimes with nurses who glamorize nursing, is that, you glamorize it, but you don't really tell that student nurse, or you tell that new nurse, hey, listen, it's going to be really stressful. It's going to be really stressful. No one understands what you're going through but other nurses. The nurses that you're on the unit with, those are the ones that understand where you're coming from. Unfortunately, even some of those mean nurses that are on a unit with you, who, yes, a lot of them are a part of the old guard because they have come into a profession also looking bright-eyed, bushy-tailed, and had a rude awakening for the past 20, 30, 40 years that they have worked in the profession. So for a lot of them, they have had that wake-up call as well, where it's just like, oh, well, oh, this is not easy like what I thought it was going to be, and they have been written up in times for medication errors from the provider. They have had their own fair share of things that they actually had to go through. So they're not looking at the profession from the same perspective that you probably come in, and maybe even some of these I hear a lot of talk about how the Gen Zs are so different than the millennials and stuff like that. And I mean, maybe that's true, and maybe that could be a part of the problem, just how we've advanced as a society. And there are people who are looking at nursing as, this could be better. So I don't fault any of the Gen Zs coming in to the professions. I'm a millennial, but I don't fault any of the Gen Zs that come in the profession and say, oh, we need to shake this up, we need to change this, we could improve this. I think that that's what nursing needs, and that also requires support coming from above. Some of those gatekeepers and those overarching bodies such as the AACN, um, they should really be looking at how can we redesign our curriculum and our approaches, that we are not only retaining nurses, so nurses coming into the profession stay, but how do we also spark creativity and innovation in these nurses, so these nurses understand that when they are in the profession, we're expecting them to solve problems. This is a profession that solves problems. And I want to say this, if I don't say anything else the whole time I'm here flapping my gums, I want it to be very clear. The reason why I'm actually doing this video is I want to dispel for any person who is in nursing school, failing in nursing school, then dropped out of nursing school, new to the profession, and asking, why did I come into this profession? Reality check. Take off the blinders. Take off the blinders. Again, doctors, nurse practitioners, PAs, they do wonderful things. Pharmacists, they do wonderful things. This is no shot at them and what they do. But you have to understand that when you're engaged in the healthcare system and you are engaging and dealing with the nurse, whether that nurse is the one that's responding to the phone calls when you call for your family members and you call into those units and you say, hey, I want to speak to my family member, I want to speak to my family member's nurse, they're calling to that nurse's station. I mean, when's the last time you said, I want to speak to the doctor, my patient's, my family member's doctor? And what do you think is going to happen when you say you want to speak to the doctor? Don't be surprised if that doctor doesn't call you until the next day. But if you want to speak to the nurse of your family member, the expectation is going to be that nurse is going to talk to you sometime within that 8-hour shift on that day. So just again, I just want to again just reiterate, we need to think about how we value our healthcare system through the lens and through the context of how we value nurses. And I'll say this before I go. I remember one time there was a young lady who I would always be on the phone with, whoever. She's my senior for, I think about it. She's like 10 years or 12 or some years older than me. But she would always make all these complaints about nurses. And I mean, she would literally talk about how much she hated nurses. I would let her talk because to me, I'm like, whatever. I'm me. I'm not a nurse. When I'm not working, I'm not a nurse. I'm me. So for me, I remember her just telling me about how much she just couldn't stand nurses, and nurses never know what they're talking about, and they're always asking for money that they don't deserve. And she was just always bashing nurses. And the more I spoke with her, is the more I realized, how can this person truly talk about her opinion about nurses and she's never been a nurse before? She's never had to respond to family members asking questions that even as a nurse, you're wondering, I wonder why the doctor made that decision. You're caring for a patient and you're wondering why that doctor made that decision, and you can't even get that question answered yourself. She's never had to deal with telling a family member that their loved one has passed. She's never had to deal with the responsibility of being the last person to see somebody alive. She's never had the experience of being the person that helped the person walk for the first time since their accident, since their event, since their childbirth. You've never been called to the office because somebody got sick. You're working in a nursing home as a nurse and a patient was given the wrong medication. Now the patient is in the ER and they want to look through your documentation. They want to look through everything you did, didn't do, could have done, should have said. She's never had to deal with that. So what she helped me understand is that the perception that people have of nurses, for some people, I think the spouses of nurses may have a better picture, but I think most people, even if they're working within the healthcare system, I think they have a very poor perception of nurses. And I think the media has a lot to do with it. And I also think nurses speaking up for themselves. The next time you talk to a nurse and that nurse says, I'm just a nurse, you ask them to tell you how they got through nursing school, how they passed their boards. Because I'll tell you something else. When people say nurses don't have to know anything, I'm going to give you a clear and my final point. When you're in nursing school and you have to sit down and pass your boards, When you sit down for that licensure for that state, they don't care what school you went to. Everybody sits down and take the same exam. You can go to Penn Nursing Program, University of Penn, you can go wherever. Any of the elite schools, you can go to their nursing programs. When you sit down and take your state board nursing exam, it is going to be based on what you know. So every single person who walks around with an LPN license, with an RN license, these are individuals who had to sit down and take an exam, and the exam did not care about what school they went to. Again, I said I was going to make a final statement, but I'll say this while I'm talking right now about this. And any fool that is saying LPN is not a nurse is a fool that should go through nursing school and then tell me if when they're finished their nursing program, their LPN nursing program, if they could even pass it, if that LPN is not a nurse. So thank you so much. I just want to address the misconceptions. And again, if you're thinking twice about completing a nursing program, I will just say, just consider these misconceptions. If you're going into a nursing program with the wrong mentality, with the wrong attitude, not focused on really developing yourself in a way to really withstand a lot of the realities of what you have to deal with when you come to the profession, then maybe nursing school is not for you. Be ready to be held to a very high standard and the pay not match it. Be ready that you have to know everything the doctor is thinking, everything the doctor knows and the doctor is thinking, the doctor is guessing, but you're not going to be paid what the doctor is getting paid. Know that if there's a snowstorm, you're expected to, in a lot of cases, stay. If other people can't come to relieve you, that you may actually have to stay. That shift may never end for you. You may go into homes as a community nurse. You may go into homes where there is all kinds of things happening in the home, and you're still expected to provide high quality care. One false move and something happens to that patient and it falls on you. I had a manager once tell me that it was a thankless job. And this is a manager who I respect her dearly, but she wasn't a nurse, you know. But that was one of the things she said. I was working for an insurance company. And she said it's a thankless job, and that's the truth. So if you don't complete nursing school, just remember that on this day, I gave you this word here. It is not the end of the world, because once you get into the profession, you have to now deal with all of these realities. You deal with people who are in, like I said, your IT folks, the engineers, the project managers, making all kind of crazy money. And when it comes down to it, it's just the value that they placed on them. So we also need to advocate for value to be placed within the nursing profession, because all of us, every single man, woman, and child, if you get sick and you have the luxury, everybody doesn't have the luxury to go to a healthcare system. Every place in this world is not developed where there's a healthcare system where they can actually engage nurses and doctors, whomever. But if you are lucky enough and blessed enough to be in a country, in a situation where you get healthcare services, not one thing happening that IT, not one thing that project manager is doing, not one thing any of those finance people are doing is going to save you. It's going to be what the nurse is doing that's going to help you. So just understand the value that this country puts on in the healthcare system should be measured through how nurses are treated. And this is my word for today. On my soapbox, because this really is something that's been bothering me, especially with the most recent strike. And we have had recently a lot of strikes with nurses, but the most recent strike and a lot of what I'm seeing, even in a lot of the job postings and the pay scale, and like the pendulum is swinging back, where all of that high pay that we were seeing during the pandemic has now went all the way back, and we're seeing very low numbers for some of these companies trying to recruit nurses. And I'm again, like I said, if you think that this is just as simple as, oh, nurses are just asking for a lot of money, you have to think about it again. Think about a healthcare system that is telling you that the people who make up the largest segment of the healthcare system, that they can be overworked, burnt out, and mistreated and exploited and paid whatever. Think about that. Think about the value that we place in all these other areas, the finance folks, everybody else can get something. But when it comes to the nurses have to argue, they have to protest, they have to do all kinds of things to get better pay. And then think about all the times that you have engaged the healthcare system. How many times have you had a doctor spend their day with you, come into your room 3, 4, 5 times a day? How many times? How many times? So that'll be the end of this. I want to thank you so much. If you understand where I'm coming from, you're a nurse and you know exactly where I'm coming from with this, again, about these misconceptions. Or if you have a word of encouragement for maybe some nurses that you see, getting the wrong ideas about nursing and you want to set them straight, please feel free to share the video, leave comments, like.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com or visit our websites www.advancednurses.info or www.acd4n.com.